Hello everyone, welcome to today's class. So today's class will be talking about common diseases in humans. Okay, so this class is also it's a very interesting one because we know what are the diseases that are occurring to us on a daily basis. So these are very common diseases that are occurring. So let's talk about that. So first, I would like to introduce you that what is a disease. So if I ask you कि what is a disease, कि क्या होता है disease होता क्या है, तो you can just say something. You can say that when we are feeling something that is not normal, or when there is when there is a problem in our body, and we can treat it, and it's showing some symptoms, then maybe that's a disease. So basically it's a right definition, exact, a bit like, if I define what is a disease, then I would say that basically it's a disorder in a body. It's a disorder in a human body, okay, which has a certain cause, okay, which has a certain cause, which is showing some symptoms, okay, about the disorder, okay, and then there are some ways to treat that disorder. So that type of condition is known as disease, okay. So I'll give you a lot of examples of diseases. So next is pathogens. What are pathogens? Pathogens are foreign substances or foreign molecules which are responsible for the disorder in your body or in a human body. So they are pathogens. Causal agents. What are causal agents? The agents which are causing the disease are known as causal agents, or you can okay, that is causal agents. Just keep it to that much. And mode of entry and action. So how are these diseases occurring, and what is the process that is being followed by those pathogens to cause the disease? How are they entering in the human body? That is the mode of entry and action. And also I'll be talking about the prevention and treatment of that particular disease. How will you prevent it, and what is the treatment that you can take? Okay, so let's start. So these are some of the common diseases that are occurring in human body. That is typhoid, pneumonia, common cold, malaria, Ascariasis, Elephantiasis, and ringworms. Okay. So first of all, I'll talk about the typhoid. So typhoid is basically it's a disease that is caused by a bacterial pathogen. Okay. The name of the pathogen is Salmonella typhi. Okay. So Salmonella typhi causes typhoid. So how does it enter our body? It enters our body through the food and water. So whenever you are taking food or water that is not clean, that is unhygienic, okay, that is not filtered, water is not filtered, the food is unhygienic, okay, when safety measures are not being taken to prepare that food, then it what will happen, this Salmonella typhi, it will enter through that food and water in our small intestine. And what does it do? What are the symptoms? It will cause high fever, weakness, pain in the stomach, constipation, headache, and loss of appetite. That means you won't feel hungry, okay. So these are some of the symptoms. Sometimes if it is severe, then it may also lead to death also of the individual. So how will you know that you have a typhoid or not? You have to do a test known as Weidel test, okay. So when you do that test, you get to know if you are suffering from typhoid or not. So what are the prevention and control? How do you prevent and how you control the typhoid? By always washing your hands, and whenever you drink water, make sure that you're drinking from a clean glass, okay, and the water should be filtered pure, okay, and then even the food that you're eating should be clean, okay. And vaccination, so you have to take a vaccination for typhoid also. So these are some of the way of treating typhoid, but some things you have to maintain, that is hygiene, okay. You need to maintain hygiene at personal level and also at public level. So personal level is basically keep yourself always clean and consume clean food, clean water. Always wash your fruits and vegetables that you are consuming. And for publicly, whenever you go outside or whenever you are in the public place, you try to dispose the your waste properly. Also excreta, you don't go near the excreta, or don't let your skin be exposed to the excreta. Also cleaning and disinfection of water sources around you, like pool, tanks and all. And also maintain hygiene, okay. Okay, next is pneumonia. So pneumonia is caused by another bacterial pathogen known as called as Streptococcus pneumonia and Haemophilus influenza. So these two are two bacterial pathogen which are causing pneumonia. Pneumonia is very common in human beings. What is happening? That alveoli in our lungs, okay, alveoli in our lungs, it will get infected. How? Because it will be filled with the fluid, and which will stop you from a proper breathing, okay, which will not help, which will cause problem in breathing, okay, it will cause problem in respiration. So due to that you will show symptoms of headache, coughing, fever, and you'll be feeling cold, okay. So and sometimes if it's too much severe, you can see your lips and your fingers, okay. So your lips and your fingers, it will turn gray or bluish in color. So you will see some fading in your lips, your finger colors and all, nail colors and all, okay. And how does this bacteria enter our body? It will enter but from an infected person, okay. Suppose a person is already suffering from pneumonia. If you are exposed to that person, okay, not just exposing, don't, it's not by touching, by you will not get it by touching someone, okay. Suppose you are using anything that that person has used. Example, suppose you are drinking from the same glass, okay, using the same utensil. Also you are inhaling, that person has sneezed and you have inhaled that droplet, so you will get that disease, okay. So some other disease that are occurring is a dysentery, plague, diphtheria and all. So how do you prevent this? Very easy, just try to stay away from people who are suffering from pneumonia. You can be with them, but wear a mask, okay. Wear mask and don't use the same things that that person is using, okay. Now, common cold. Common cold is caused by rhinoviruses. And what does this viruses they do? They will infect the nose and the respiratory tract of the human. Okay, they will not. They will not do anything to the lungs, but the passage. Okay, they will infect the nose and the passage. Okay, by which we breathe and all. Okay, by which the air moves in and out of our body. So it will lead to nasal congestion and discharge. Also, you'll have a sore throat, your voice will break, your hoarse, there'll be a hoarseness in your voice, and you will have cough, headache, and you'll always feel tired. So you basically, because that is because of weakness. So this is all the symptoms of common cold. So how do this virus enter our body? Same thing. Suppose somebody is coughing or somebody is sneezing, not somebody but an infected person who's already suffering from common cold. So if you are in front of that person and you also inhale the same droplets of that person, then indirectly or directly you are getting infected, okay. And suppose that person is using, that person may use anything, okay. So if you're also using the same thing, you're also exposing your body to that virus, okay. So how will you prevent it? Simple, stay away, stay a bit far from that person, use mask, and sanitize your hand, or keep sanitizing your hand, wash, keep your hands clean. And whenever you touch your nose, eyes, so you should always make sure that your fingers are clean, and use mask, and do not be in too much close contact with that person, okay. And keep your belongings clean, okay. Next is malaria. So what is the causal organism of malaria? Plasmodium. It's a protozoa. Remember this, it's a protozoa. So there are many types of Plasmodium: P. vivax, P. malaria, and P. falciparum. So among these three, P. falciparum, Plasmodium falciparum, this is the most dangerous and the fatal one, okay. And out here, P. vivax is not, it is not so like too much fatal like Plasmodium falciparum, but it's also dominant species, okay, for causing malaria. And you have heard about dengue. So dengue is caused by AIDS, okay. Not that AIDS, AIDS, Aedes aegypti, okay, aegypti. So this is one species that is causing dengue. But in malaria, it's caused by Plasmodium species: Plasmodium falciparum, Plasmodium vivax, and Plasmodium malaria, okay. So how will you prevent it? It's very common. You know how to prevent it. Use mosquito nets. Then also avoid stagnation of water. Make sure that the water sources around you, it's not dirty. Okay, there is no coagulation of, or there is no stagnant water around your house. Okay, and because when there is stagnant water around you, the mosquitoes, they will breed there. Okay, so you have to stop them from breeding. You need to eliminate or clean those places. Then you can introduce some fishes into that water sources, which takes in, or which feeds in with those mosquito larvae, okay. So you can spray insecticides in those places. And also you should always try to keep your door and windows closed, or at least keep a wire mesh to prevent those entry of mosquitoes in your home. There are some other ways, like use mosquito coil or mosquito repellents, to keep yourself safe, okay. Now, life cycle of Plasmodium. This is very very important. So how do this mosquito, how do they infect us? So basically, when a mosquito bites us, what does it do? It will uh, it will release some sporozoites. Okay, it will release some sporozoites in our body. Those sporozoites will go to our liver. Okay, through the blood, it will reach the liver. It will go there. It will reproduce there asexually in this liver cells, and it will lead to the busting of that liver cells. Okay, and it will release the blood. Similarly, this parasite will again go to the red blood cells, RBC cells, where again they will reproduce asexually, and again it will lead to the bursting of the RBCs. Okay, therefore what will happen, when this will keep on occurring, you will start feeling fever, you will get fever, and you will get other symptoms and all. So these parasites, they will keep on infecting new RBCs. Okay, so they will keep on infecting new RBCs. So so basically, when the cells are being busted, what is happening? There are some gametocytes formed. Okay, there are some gametocytes developed. So again, when an insect bite, it will take up those gametocytes. Okay, along with the blood that it will suck from the human beings, it will take up those gametocytes also. And inside that mosquito, okay, inside that mosquito's intestine, fertilization will occur. Okay, and that will lead to formation of more sporozoites. Okay, it will lead to formation of more sporozoites. Again, when this insect will sit on a human being's hand or wherever, it will again release those sporozoites inside that human being. So this cycle is keeping on going on. So okay, so basically you can see it is reproducing asexually. So this is the life cycle of Plasmodium species. Okay, which is causing malaria. So I hope you have understood this cycle. It's very very important. Okay, now next is amoebiasis. What is amoebiasis? It's also known as amoebic dysentery. So this is caused by another protozoa known as Antimobia histolytica. Okay, Antamoeba. Okay, Antamoeba and histolytica. It's also a protozoan parasite which is present in the large intestine of human beings. See, I've given pictures out here, so you can see how it is, how does it look, and how its symptoms, how it's showing. So what will happen? It will lead to, when it enters our body, it will lead to excess mucus and blood clots. Okay, inside you will also feel constipation, and you will also feel pain in the abdomen. There'll be cramps. Okay, so the stool that you, with the excreta that you will excrete, will contain blood clots, and there'll be too much mucus in that excreta in your stool. Okay, so how does it enter our body? Through housefly. Okay, suppose a parasite was sitting in a fecus of an infected person. Okay, so when it will fly, it will sit on a food or any products which we will take in. So it will end, by that it will enter our body also. So basically by food and drinking water, okay, this protozoa will enter our body. So how will you prevent it? Again the same thing, personal hygiene and public hygiene. How will you maintain it? Keep your body clean. Okay, then drink clean water, and have hygienic food, wash vegetables and food before you consume them. When you go out in the public, try to dispose the waste and excreta properly. Also disinfection of the water reservoirs and cleaning. Okay, so you maintain follow the standard practices of cleaning and hygienic way of living. And how do you treat this amoebiasis? So for treating this, you need to use some antibiotics, some anti-parasite drugs. Okay, and also hydration is very very important. And there's a compound known as metronidazole or tinidazole. So this using these chemicals in your medicine will help you from treating this amoebic dysentery. Okay, now moving on to next, Ascariasis. So Ascariasis is also it is caused by another parasite, or you can say roundworm, known as Ascaris, and also Wuchereria. Okay, Wuchereria. It's also another worm. Okay, both are common round. Ascaris is a common roundworm, and Wuchereria is a filarial worm. So basically, they're coming under Helminthes group. So Helminthes is a parasite. So they will again infect the intestine. Okay, they will again infect the intestine. So what are the symptoms when you can see in the diagram out here, it looks very weird, but that's a fact. So when it will enter our intestine, there's all type of worm like structures. Okay, it will cause internal bleeding. Okay, you will show fever, you'll have anemia. Sometimes what happens, internal passage gets blocked, you have to operate, and you can see those doctor taking out the worms and all. So when with the fecus, Also, these eggs and all, they are excreted with the feces of an infected person. Okay, and when a person uh, goes and when he goes and use, like when he doesn't use a proper bathroom, when he goes and excretes in the pub, in a outside in field, or in mud soil and all, what does it do? He, from since he's infected, he also infects the soil around him. Okay, so again that will again be spread on to fruits and vegetables or another trees. Okay, since since that worm is contaminating the soil, the water, the plants. So again, when we are consuming vegetables and plants, if we are not washing them properly, then there's a chance that these worms might enter our body. So we have to keep our body clean. We have to use we have to wash the vegetables and fruits that we are consuming. We need to consume clean water. Okay, clean food. Again, same thing, since it's entering our intestine through food and water. So again, you have to maintain public hygiene and personal hygiene. Okay, the same thing for all the diseases that are caused by food and water contamination. You need to maintain your personal and public hygiene. Okay, so what is the treatment of this disease? Treatment is, you need to use anti-helminthic medications, since it's a helminthis group. So you have to use those drugs that will remove this parasitic worms from the body. Okay, example is albendazole and mebendazole. These are some compounds that are used. Okay, so this is about ascariasis. Now, elephantiasis and filariasis. It is very you have seen this above. I'm sure you have seen it in some people. So again, this is caused by Wuchereria, but it is another species. Okay, W. bancrofti and W. malai. They are again filarial worms, as I've told you in my previous slide. So this causes elephantiasis. So when this worm, when they enter the body, okay, what does it do? Slowly, it will lead to chronic inflammation in those organs in which those worms are residing. Okay, these worms will stay in your body for a long, long time, and slowly it will lead to inflammation of the organs, usually the lymphatic vessels of the lower limbs. You can say the leg portion. Okay, lower limbs, it will lead to the inflammation of that lymphatic vessels. Okay, so what are the symptoms? It is already, since it's there for a long time in the body, it is causing damage to the limb system. Okay, which is leading to swelling of the legs, arms and genitalia. Okay, in some people it also affects the genital organs. Okay, so it will lead to the bacterial infections in the body, and also it will lead to thickening and hardening of the skin. Okay? The skin looks very hard, and this and it's not smooth. Okay, so this is all the symptoms of the this disease. And what is the source of infection? As I told you. Okay, now this is also, suppose a mosquito bites. Okay, so mosquitoes, they might contain okay, female mosquito vectors. So basically, if it enters our body, okay, when the pathogens are transmitted to a healthy person through the bite by the female mosquito vectors, and it may lead to this infection. Okay, now treatment. How do you treat this? Again, same thing. You have to use antiparasite drugs and antibiotics to eliminate the vectors and the breeding places inside our body. Okay, so this is all about elephantiasis and filariasis. Next is the ringworms. Ringworms is a very, very common disease that is occurring in the humans. You can see a reddish mark, round marks in your body. Okay, now ringworms is caused by fungus known as microsporum. Okay, trichophyton and epidermophyton. These are some of the fungus which are causing this ringworm. Okay, so how does it look? You will see a dry scaly skin. Okay, lesions means round like structures in various part of the body. It will cause too much itching in that part. Okay, so how does it spread? It is spreading when there is moisture in your body. Okay, suppose, see, fungus needs moisture to grow. So in any part of the body where there is heat and moisture, it may have chance to grow in that part. Okay, it will grow in that part, it will survive in that part. So in our body, which are those parts, like underarms, then you can see groin part, then between the toes. Okay, and then you can see the neck portion. So you can see some in the stomach portion, in hip portion, whenever a person is wearing tight dresses and all. So it will lead to too much moisture or heat or sweat and all there, so which will provide a very good hybrid like breeding ground for the, or you can say very good place for this fungus to grow and develop. Okay, so remember this. So what are the sorts of infections? Suppose some individual is already infected, and you are using that person's towels or that person's clothes, or you can also come to your body through from soil and all. So this is all leading to this disease, ringworm disease. How do you treat it? You have to use a very good antifungal cream, lotions, powders, soaps, which are which will help you in eliminating this sort of environment in that skin. Okay, so this is all about today's class. These are some of the common diseases in human beings. I hope you have liked the class. If you have liked it, please to like the press click on the like icon, share it with your friends. And it's a very common topic, everybody can study about, learn about it. And also please to subscribe my channel for more such videos. Your subscription will give me motivation, and I will keep on uploading more classes. Okay, so thank you so much for attending today's class. Have a very nice day.